Okay. Hi guys, as you see title today, I'm gonna be talking about, yes, cancer. This is not clickbait or anything. I just want to tell you that I've been having a little bit health issues, but yet I don't know if it's cancer or not. I'm gonna find out this on December 5th. I have some papers from doctor. This is my uterus and the ovaries, and I have basically thickened endometrium. I did surgery last Wednesday. Okay, a little bit hard to talk, but let me tell you, let's start from the beginning, how everything started. I'm trying to be positive and everything gonna be all right. Yeah, so okay, everything started like a little bit more than a month ago, like 2 months ago. I started to feel like weird symptoms in my uterus. It started to be painful. I started to bleed in between periods, which is not normal. I am 31 and this never happened ever in my life. Like, I knew exactly when I'm gonna have my period, when I'm gonna finish, and always was like the same amount of period, the same amount of blood, and nothing changed. My life, the last 15 years, everything was perfect with my period. So like 2 months ago, I started to have like a lot of crampings, a lot of pain in my lower abdomen, and kind of was feeling like I was trying to, go to the toilet, to poo, but kind of feeling like you're constipated, but it's not that, completely different. Then I started to have like spottings in between my period. Wherever it happened, the one night that in between my period, actually I was ovulating. The day when you ovulate between your periods is like, I don't know, it's like 10 or 15 days. I started to bleed a lot. I woke up 4 in the morning. I started to bleed a lot. Like, it wasn't my period, but I started to bleed a lot. Like basically like water running, like so much. So I went to ER. I have a papers here from ER. This was, I got ultrasound done. I got everything done basically, but they found nothing. And I spent there 6 hours in the ER. When I posted picture, you guys were worried what happened, and I say everything is fine, because this is what they told me, but I knew something is wrong. So I have here report from ER doctors, and they say when they did ultrasound in my uterus, they say like basically everything is fine, but the one sentence that I don't like, they say there is a small amount of complex fluid within the fundal aspect of the endometrial cavity, likely presenting blood products in this patient with vaginal bleeding. So basically they told me that it's completely normal, that sometimes periods can be very heavy. I say I don't have heavy periods. I have normal periods, but I never had to buy maxi or like night pads ever in my life. So wherever I come back home, I still bleed, and I'm just like thinking this is not normal, because I went in Baptist Hospital, emergency hospital, which is considered the best hospital in Miami. All right, I don't care about these papers. I call my gyno, I schedule an appointment, I go to my gyno like after a week after this, after like 10 days or 2 weeks. So I went to my gyno, I tell about my symptoms, I tell her about that. I went to ER, that they didn't find anything, that they did examine like really, they examined with the ultrasound my uterus like basically for like 20 minutes, and they didn't find anything. She said, I don't care what they did, I don't care what they say, I'm gonna send you again for another ultrasound in their facility. They did ultrasound to me. She asked symptoms, I see cramping, and she say, well, this is not normal. And then when she did ultrasound, she say, you have a polyp in your uterus. Basically, I say, what is this? She say, this is not dangerous, it's not cancerous, everything is okay, but we have to remove it because it's 1 centimeter. 1 centimeter is considered like big, and especially when I had symptoms, bleeding and cramping, this is not good, so I have to remove. So last Wednesday, I had the surgery. Amazing. I had in surgical park center in Miami. Amazing stuff, amazing people, so like funny people. They tried to cheer me up and try to make me happy. I was like, I'm not in the mood, but I try to be in the mood, when you know that there's something going on in your uterus. But my gyno say everything is fine, and don't worry, you're gonna be, the procedure is very fast. I had a full anesthesia, like general anesthesia. She did the surgery for like, I don't know, surgery lasted like, she say like, basically what she did, the cutting like 20-25 minutes, but the time when I go in the surgery room, anesthesia and everything, preparation, it took like 1 hour. So I'm freaking scared of anesthesia like crazy. I told her that I have panic attacks and stuff like this. So before the surgery, they gave me something like made me fun. I was laughing like crazy. I remember they injected something in my IV, and I was laughing funny. I was looking at all the doctors. I was laughing like crazy. So whatever. During the surgery, she found no polyp, but she found something more serious. This is what she found actually. This is right ostrea. This is left ostrea. I don't know if you're going to see, guys, because of the camera. Basically, my ovaries are fine. One is bigger, one is smaller. That's completely normal. This is my cervical canal. This is so funny to show you what's inside my butt. I'm making this video. If somebody has these symptoms, please don't wait, get to the hospital, get to your doctor and get checked, because this is serious. All right, this thing, what it is, this is thickened endometrium. Thickened, sorry for my English, thickened endometrium. So basically, what is this? Basically, my uterus is a little bit in some spots thicker than usually should be, and thickened endometrium is a sign of the cancer, which is called endometrial cancer. Oh, I'm a little bit scared now, so I'm waiting for, during the surgery, she basically removed this tissue that she didn't like, this thickening thingy, I don't know how to even say. Basically, she removed this stuff, and they sent to the lab to test if cancerous or not, but basically this is, I had like basically 4 signs out of 5 of endometrial cancer. This actually thing for young people, it's like not common. This is common for women that are over 50 years old, basically when they have menopause, then the hormones and stuff like this. This is very common between 50 and 70 years old women. I am 31. This is really uncommon in my age, but it is what it is. Basically, I'm waiting December 5th until they're gonna get results from the lab. What is this, cancerous or not cancerous? But I really hope that it's not. But I found on YouTube one video made by the doctor, and I want to read a little bit for you guys. What is this? Endometrial cancer affects more than 635,000 women in United States alone every year. But there is no standard screening test designed to catch it. Pap smears don't check for or find endometrial cancer. So basically I did pap test like every year and it's nothing, everything is okay. So this is what it says, but there is no standard screening test designed to catch it. Pap smears don't check for the find endometrial cancer, and most women who get it, they have normal pap, says Nita Karnik-Lee, MD, Doctor, Associate Professor of Obstetrics and Gynecology at the University of Chicago Medicine. In order to detect the disease, your doctor will have to order transvaginal ultrasound or CT scan. This is what happened. I basically don't know what else they did, because I was under anesthesia and everything. My doctor, she had surgery after me and I wasn't awake. After she got to another surgery, I wasn't awake till then, but this is what they gave to my husband. This is what she says. She removed this stuff and I have to wait basically from the lab results until December 5th basically. Now I want to tell you guys symptoms. If you have some symptoms, get your ass to the gyno and get yourself checked. So the first symptom of endometrial cancer is abnormal bleeding, especially in between your periods. For example, you had the period like 7 days ago, is finished, you clean completely, and then after like 7 or 10 days you have again bleeding. And especially if you have heavy bleeding, this is a sign. If you have a pain in your lower abdomen, what I had a pain, I had like a pressure pain, like I had like pressure, like pressing me something like hard in my basically in my uterus. Pain that really freaked me out. Then another symptom is if you have pain during sex, if you don't want to have a sex, if you like you don't want to have any intercourse, you don't even think about it, like it's like you have like pain. I had the pain, so I'm like I knew there is something going on. Another symptom that I had a lot of breakouts. I still have a breakouts, and I think when you have breakouts over here on the jawline, somewhere over here around, this is something going on with the lower abdomen, which is woman-related problem, like either ovaries or uterus. Losing weight, also I lost weight. I don't want to scare anybody because I'm scared myself. Losing weight also is one of the symptoms. I lost, I don't know how much I lost, like 6 pounds, but I hope this is just like stress. Reason why you get this actually is like bad diet. My diet is amazing. I'm a vegetarian. Can be stress, can be like obese, like diabetes. If you have diabetes, it can be higher risk to have endometrial cancer. Now, I'm not saying that I have cancer, I really hope not, but this kind of warning to my body that is like basically my body is warning me that is something wrong, something I should change in my life, maybe stress less. I have a lot of stress lately. I have like crazy stressful last 3 months. It's nothing related to my business, it is related a little bit to my relationship. But this is what happened to me. This is what I have. I had this thing removed, but I don't know what lab results gonna show. I'm gonna do updated video after I talk to my gyno, after they gonna see that I have or I don't have and what's gonna be. But my symptoms, yeah, my symptoms were really bad. I end up in ER. Oh my god, I'm not thinking about worst. I'm just saying, I just want to share with you guys what's been going on. I've been filming much less than before. I don't know why actually when they did the first ultrasound they didn't see anything. When my gyno saw that it might be a polyp in my uterus, then polyp somehow it disappeared, or maybe appeared the ultrasound that is gonna be polyp, but actually she found this is thickened endometrium. I really hope that there's nothing wrong. I'm gonna update you guys with a video after December 5th when I'm gonna find out what's going on with my uterus. And yeah, I know this everything came just because of the stress. This is something that I am trying to control, but I cannot. I'm very emotional person. I'm a very sensitive person. Always when something happened to my health, I'm thinking the worst, and it's just not like I cannot change this. I'm just thinking about the worst. I know, like when something happens, especially when I end up in ER, I'm not like ER person. I went to ER last time like 5 years ago because I had fever for like 20 days. So then I went to ER to check if I don't have some crazy virus. But this time I end up in ER because I was bleeding so much. I know this video is a little bit different, and thank you so much for watching. Thank you so much for being subscribers here on my channel. Thank you so much for supporting my Jean Amber Beauty small business that I have. Yeah, and my surgery actually of this thickened endometrium tissue removal costed $18,000. Thank God I have insurance. I have a great insurance, which I didn't have to pay anything. But yeah, it costed $18,017. And by the way, if somebody needs a recommendation for gynecologist office, is Jaclyn Ferro is in Miami. Excellence, Miami Obstetrics for Gynecology, Miami Excellence for Obstetrics. Oh my god, I don't even know. So I'm gonna link down below my gyno office where I love her. She's amazing woman. My gyno is Jaclyn Ferro. I love her. She's such a positive, nice woman. I love her so much. Just amazing woman that she found out like very early. Yeah guys, that's it for today. Thank you so much for watching. I love you so much. I really hope December 5th is gonna be this super positive day. Please keep fingers crossed that this is not cancer. I really hope that it's not. And thank you so much for watching guys. I see you in my next video. Bye.